Okay, so now we're actually going to talk about tourniquets themselves. I think that it's important to explain why tourniquets and hemostatic dressings are so important about how they work and why they work, not just, hey, here's how you put it on. Because there have been so many bad dealings, I guess would be the way to say it, about these in the past. I think part of what I need to do is educate people as to why, not just the how. But here's the how. So tourniquet early and tourniquet often is the phrase. So these were improvised tourniquets, and they saved the guy's life, but you can see he's still bleeding. The idea behind this is that you stop the bleeding with the tourniquet. So improvise, use them if you have to, but you've got to keep your eye on them. And the other thing, the other phrase that goes with this is called high and tight. As high up on that limb as you can get them, as tight as you can get them. So the two basic tourniquets that are out there, the one on the right, the mechanically assisted tourniquet mat, I haven't seen this for sale for a little while, and it's too bad because this is the one I prefer. I think it's easier to apply one-handed, and I think it's easier. I think it's easier to apply two-handed as well. I've used both on patients, and they work just as well. Either of them have worked just as well. The one on the left, the black one, you've got to have some hand and arm strength to get that tight enough. And I look at it as I want a tourniquet that I can put on myself one-handed if I had to, and that's the one on the right. I don't own any stock in it or any of that crap, but that's just the one I prefer, and that's why. But a commercial tourniquet, regardless, will work well. Now, 5, 6, 8 years ago, there was a big concern out there about quote unquote counterfeit tourniquets. People were buying them on eBay. They were $5 tourniquets from China. And the windlass, that black rod, was cheap and breaking. I've bought a bunch of tourniquets off of Amazon, both the brand name expensive ones and the cheaper ones. The $5, $6, $8 ones that are out there now. And I've used those tourniquets a lot in classes, and I've never broken one. So I think if you buy one from a decent company, I think it's better to have a couple of cheaper tourniquets than it is to have only one or no expensive tourniquet. Now, there are some other things that are being called tourniquets out there. And the TK4, is one that Action used to have, and that's where my experience with it was. And I'm not a fan of it. It is small, it's easy to put in bags, and it's cheaper. I think it was like $9 for a stretchy band and 2 S hooks. But you need to be able to apply enough force while wrapping that to cut off blood flow. And the other thing we want to do is, the old saying, above all else, do no harm. Well, when you put that tourniquet on tight enough, that hook that's going to be on the bottom is going to dig into the skin. And if you happen to slip with that thing and let go of it, or it breaks, one of those hooks can, it's all fun and games till somebody loses an eye. I don't like them for that reason. The rats at the bottom is similar. It's you have to wind it around tight enough and then loop it through those different hooks. I think that currently, with the expense of some of these so-called knockoff tourniquets, I don't see there's a reason to spend money on something like this. Now, on the bottom right, SWAT T, they call it a tourniquet. It's a rubber stretch band. And yes, you can make that tight enough to work as a tourniquet. But if you look, there's these little circles and squares and diamonds, and you've got to pull it tight enough so that they change shape, and there's too much to it. Who in their right mind wants to be spending time looking at that, trying to figure that out when you're trying to stop somebody's bleeding? And blood is slippery. If there's blood on that limb and you're trying to wrap that around it, it's a nightmare. Now, the Israeli trauma dressing, people say, well, you can use that as a tourniquet because when you pull that, you put the ace bandage looking part through that plastic clip and you pull back on it. You can get it tight enough to be a tourniquet. No, not really. That's a great battle dressing. It's a great trauma dressing. Absolutely great. It's a great pressure dressing. The other thing that worked just as well is a 5x9 folded in half with a good ace bandage around it, because basically that's what you've got right there for 12, 15, 20 bucks, whatever it is. It's a great dressing. Buy things and use them for what you want to use them for. If it's a dressing, use it as a dressing. If you want a tourniquet, then you buy a tourniquet. Now, when we start talking about putting tourniquets on people, do we take the time during triage to apply them? Yeah, because it takes 15, 20 seconds, half a minute. And you can have somebody who right now is, they need care. They're not walking wounded. They need surgical intervention, but they're not in shock, so they're yellow, right? But if you don't put a tourniquet on them fairly certain, and fairly soon, they're going to become red and or black tagged because they're going to continue to bleed. So yeah, you take the time during triage, you throw a nasal airway in to keep the airway open, throw a tourniquet on to control hemorrhage. Now we're going to go more into tourniquets in a minute, but hemostatics. So hemostatics are a chemical agent that might be in a powder form, or it might be embedded into a dressing. It might be embedded into little styrofoam pellets. They look like styrofoam pellets. But what they do is they soak up the liquid in the blood and allow the platelets to clump together better and create a much faster clot. Now, quick clot you can buy at Walmart. I've seen it in the pharmacy. I've seen it down in the sporting goods section. A lot of times we use the term quick clot, the one on the bottom right at Walmart, but we use the term quick clot to describe all of these. There's a bunch of different ones. They are technically hemostatics, but we kind of use the term quick clot like we would Band-Aid or Q-tip. This one, Celox A in the middle, is an applicator, kind of like a cross between a syringe and a tampon applicator. And you take the blue tip off, stuff it down in the wound, and then push the powder down into the wound, and that allows it to work better and faster. There have been some concerns with the powders, especially in a windy environment, that you spray the powder on and the wind sprays it off. Shield it, get a dressing there ready to go, put the powder underneath it and immediately fold the dressing onto it. You've got a hole, pack the wound with the powder and then put a dressing over the top. This combat gauze is nice. It's not gauze like you'd use cling to wrap around. This is gauze that you would use to pack into the wound, and it's saturated with the hemostatic. So you pour the powder into the wound, you put dressing over the top, and then you apply direct pressure to that dressing. Now this Xstat is by prescription. I don't know how much it is. I haven't bought any of it to see. As you can see, you can put it into a fairly good sized wound, dump it in. Now the little lines that you see are radiographic, so these things will show up on X-ray. Now this is a tourniquet. It's a junctional tourniquet by the company Sam, like Sam Splint. And this is for junctional type injuries. So in the pelvis where you can't get a regular tourniquet, or up in the armpits, the axillary areas where you can't get a regular tourniquet. This takes some playing with. And what this does is, if we look on the left side under the inguinal areas, that TCD is an inflatable balloon, basically. And what you're going to do is you're going to place that over the pressure point up in the groin, over that iliac artery, the top of the femoral artery to the iliac artery area. And you're going to put that belt on super tight, and then you're going to pump that bulb up, and that is going to push against the belt. That's why the belt has to be really tight, and it's going to push down to occlude that pressure point. You can also use it up in the armpit, and that goes up on basically the subclavian vessels. Now, the thing I don't like about it with the chest is when I say you've got to tighten it, you've got to tighten it. And it can make it hard to get a good rise and expansion of the chest wall because of that. But it's certainly something that, we don't have access to otherwise with a regular tourniquet. So this is another type of junctional tourniquet. It's you put this on, you tighten it down, and then these two handles, you place those over those pulse points in the groin or in the arms, and you tighten them down. Basically, you're putting a medieval thumb screw to their pressure point. So anytime you're using this, or you're thinking about using these things, don't forget, you need to have overall picture of it. No tunnel vision, please. Okay. Now, what I recommend is that you buy some of these tourniquets, or if your service has them, you pull one out and you play with it. You practice with it. You put it on yourself. In the old days, we talked about putting it below the knee and below the elbow so they'll have a good stump for a prosthetic. We know they don't cause people to lose limbs. So high and tight, as high up on the thigh and as high up on the humerus as you can go, because there's only one bone there to compress all the vessels against. I've put tourniquets below the knee, and that was the other thing with that tourniquet from the helicopter I told you about, is that was below the knee, and there are two bones in the lower leg, and between the two bones there's blood flow, so you can't compress that. So high and tight, as tight as you can go. Recheck in 5 minutes, tighten it again. Okay. Carry these in your vehicle. You spend 10 or 15 or 20 bucks on a tourniquet or two, and hemostatic powders are kind of expensive. You could spend 20 or 30 bucks for a couple of dressings, but you put those in your car and you're set. If you need them yourself, you've got them. If you happen on an accident, you've got them. I would rather spend that money and help somebody out than have them bleed to death, while I'm waiting for an ambulance that hopefully will get there. But remember, tourniquet early, tourniquet often, before shock sets in, strongly associated with saving lives. And now these quick clots, the hemostatics, if I've got an arm wound that I could use quick clot in, I might do, if they're not bleeding to death, I might use a quick clot first, just because you've got to remember with tourniquets, they hurt. Tourniquets hurt a lot. They hurt right where they're applying the pressure, and also when they cut off the blood flow to the arm, they hurt. So you may be a BLS truck and you roll up on a guy with a lacerated forearm and you throw a tourniquet on and you're like, hey, great, I don't need a paramedic because he's not going to die on me. You need a paramedic for pain control. Okay. So tourniquet early, tourniquet often, high and tight. If you have any questions, shoot me an email. All right, so that's part 5. Thank you.